Let's talk about the misconception that people have about neonatal jaundice. Most of the people believe that, in olden days, especially our grandmas, they believe that when your baby have jaundice, you either use pawpaw water, they give the baby pawpaw water in Nigeria. Some people even give the baby, there is something that they will cook and they will start giving the baby. Some people give the baby concoctions. Some people will go to the chemist and they will get this ampiclox syrup and they will start giving their baby that it will clear off the jaundice. No, that is not the treatment of jaundice. Did you know that anything you give a baby, their liver is not yet developed, and anything you give the baby through the mouth, it goes into their system. Most of the things in their system, all the organs that is not yet developed, most of the things we give the baby in the world, we calculate them. We have a way in which we calculate them. So if you give the baby all these things, their liver is not yet developed, and it can lead to a lot of complications in their system. So stop giving your baby yellow pawpaw water. No, don't do that. When you come to the hospital, there is something we call, in which we expose the baby's skin. We wear pampers for the baby, then we cover the baby eyes, and we place the baby under this light. This light used to drain the jaundice from the baby's body. So instead of giving this, come to the hospital. After doing that bilirubin test that we do for the baby, if the SB is more than 18, there's another thing that we can do. We can do exchange blood transfusion. If you notice that your baby is having yellowness, discoloration of the skin and the eyes, come to the hospital. Let's talk about the prevention. In neonatal jaundice, you might not be able to prevent it, but if your early detection, if your baby have jaundice, you notice all these things, come to the hospital. Meanwhile, the postnatal care, in which they will ask you, they will give you dates that you should come to the hospital for checkup. Bring your baby to, if they give you like 24 to 48 hours, after 72 hours, and you should come back so that we assess the baby. They will do tests for the baby. If they are able to detect this jaundice on time, it will prevent a lot of complications. Then they will be able to start the treatment on time. And let's talk about the complication of jaundice. It's not a small thing, because this jaundice, when it enters the bloodstream of the baby and it's being transferred to the brain, it can lead to something we call kernicterus. The baby might enter coma. Some baby will start having seizure, and it can lead to death. Even it can lead to brain damage, behavioral disorder in the baby. It can lead to ear loss. So it has a lot of complications. In order to prevent all these things from happening to your baby, when you discover that your baby have yellowness, discoloration of the eyes and the skin, come to the hospital. Then the government should provide enough equipment in the hospital, most especially phototherapy lights. All hospitals should have, if you have a private hospital, provide phototherapy lights in your hospital. Don't give them ampiclox syrup. Provide phototherapy lights so that when you detect it early, you'll be able to start treatment on time. Health workers should be aware. There should be training for health workers how to manage all these conditions. People should be aware. The health workers should go to the marketplaces, the churches, teach them about all these things. Let people be aware that pawpaw water cannot cure jaundice. Thank you.